like to invite Dr. Hafiz, the founder of APPS UK, back to coordinate the session further. Thank you.
I think I'll quickly pass over the mic to the chair. Just for concluding remark. Sorry, we are pushed for time, and inshallah we want to finish at past, and that will happen.
Boy, oh boy. Today I feel like a doctor again, not just a urologist, and that is the beauty of this meeting I've realized. We have compartmentalized our profession so much that even in urology, I'm just supposed to look at cancer and nothing else. So I've forgotten how to treat a patient with incontinence and patient with stone. And I think this was absolutely fantastic experience for me. And it started with my very dear friend Amir Ghafoor, this session. I've known him for 40 years, and he's getting worse as he's getting older. He's not around, thanks God. Let me tell you one thing. These figures will tell you 61,000 patients seen in 3 months of time. That tells you the phenomenal work which Lady Reading Hospital does in Peshawar. And I'm proud to say that I've graduated from Khyber Medical College, and we were trained in the best possible way. And there is a huge diaspora of doctors from Khyber Medical College serving all over the world. Just to reassure him, I can tell him that only 6 weeks or 3 months ago, we appointed 3 accredited A&E consultants from UK who went back to Lady Reading Hospital A&E department, and that's thanks to Dr. Noshirawan Barki. Usman Khan, are you around? Is gone. Okay, this is cousin of Usman Khan, who has come from America. Again, another model which APPS needs to look into. He stood his ground in spite of all the government against him. He's just a single man transformed the whole. How big is the hospital, Sir Dawood? 1,800 bedded hospital, and with the 38 specialties. Now, what to say about Professor Dawood Khan? He's a legend, living legend. What he presented was not somebody else's figures picked up from all over the world. That's the beauty. What is a living legend? He presented what he started from zero, from A, went up to Z. And I'm witness to it, Qazi is witness to it, and everybody from KP, my wife, my better half Shahina is witness to it, that he actually transformed the ophthalmology, the eye patient care in KP, and hopefully in Pakistan as well. And I'm proud. Every district has got a FCPS, fully trained ophthalmologist, personally certified by Professor Dawood to be able to do everything. And words can't say, it was a sheer tour de force of history, of professionalism, of clinical excellence, in the most unfavorable circumstances. The only other person I can think of who can match Professor Dawood in any way is my dear senior Professor Adib Rizvi in Sindh. Dr. Inam, great man. Treating patients who cannot afford quality care. Are you around? And I'll tell you something. 1996, Mark Fordham was my trainer, and he said to me, Altaf, why do these people come from your part of the world trying to find solutions in this system for their country? The two systems are totally different. 1996, 20 years ago. And it hit me. I thought he was racist. No, he was absolutely objective. I totally agree with you. Local problems needs local solutions. I went to India, and I'll tell you, for laparoscopic surgery. What happened there was, my very dear friend who is now program director, SSC, vice chairman, Phil Conford, he said, we'll go to India to learn. I said, Phil, we need to go to Hamburg and all these things. God, let's go to India. We went to India, to Ramalingam was the surgeon, very famous urologist. Small town outside Chennai, were put in a car. There were 3 stops on the way. He picked up all his assistants who were waiting for him on the roadside. We went somewhere where we had the Indian breakfast, okay? And then we were taken to a hut in the middle of fields. That was the vet laboratory. There were pigs around. They put the pigs, anesthetized them for us. So do whatever you want to do. Boom, 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 boom. We did all the nephrectomies and then now stitch it. We were stitching on all these things. After 2 hours of lunch and everything, we came in the evening. The pigs were up and running and eating. And Phil said, my patient is doing very well. In the night, enhanced recovery. Yeah? In the night, we then next day went in and he showed us how to do. Over here, they were thinking of the most expensive balloon, how to do retroperitoneal inflation and all these things. Ramalingam put a rubber glove around the laparoscope and then started filling it with air. And it created the cavity, retroperitoneal, and we did the nephrectomy. He said, it's 10p or 1 rupee of glove. Why do you want this thing? So local problem, local solutions, yeah?
Could I say something here to this, right? I partially agree to be disagreed because I'm also doing the charity work at this part of the world. And the outcome, if you look at auditing, if you do the research on the outcome of the thing, we are still very in an orthodox stage where we're doing the old things and we are not translating our skills and expertise into the new era, then you are not going to achieve. Because we have no accountability there, with no auditing, no research.
Yes. We will take that, we can discuss later on. I'm just sharing my experience. Shahid Khan, I'll tell you patient safety. Let me tell you one thing. Linda Grayton, professor of business school, London Business School, in her book, Future of Work, she quotes, brilliant, and I put red line on it, that by 2050, almost 100% scientists and medical sciences will be coming from China and Indo-Pak region, because the West, the future of the West, future generation are more interested in football and guitar playing and all these things. They don't want to do hardcore sciences. It is an eye-opening book. Please do read it. Future of the Work, Linda Grayton. Okay. Usman Khan. I am a more-fashioned surgeon trained by great icons. I never believed in enhanced recovery till one of my registrar, whom I appointed along beside me as a consultant laparoscopic surgeon, he actually started first on his own patient and then without asking me started sending my patient on enhanced recovery as well. I looked at my figures and I was very impressed. I said, Rahul, look, my patients are doing as well as yours. He said, because I'm sending them along with my patients. So I got converted, okay? And Teresa, I'm getting old, I had to get to the toilet, but I can tell you, my hospital, my unit is among the first units who have been actually training the physician assistants, associates. They are lovely, lovely, make my rounds more colorful, more interesting. There are pretty girls all around, yeah? And we go around 200, and let me tell you, Salford University, Manchester, have got 200 of them, and we are training them. And last but not the least, my dear Saima, I always tell my registrars that be a reflective surgeon, not a reflexive surgeon, that you, no, reflect what you are going to do. And this is, they say, what, can we write it? I said, no, don't write it. Anyway, fantastic, and I think, this, give me 1 minute for this. I really wouldn't change the format. I wouldn't really change the format. I'm sick and tired of listening to urology. And I was absolutely my mind blew away when I said that, when I was listening to my dear friend from America who was telling me how many doctors are committing suicides, and I was gobsmacked when I was listening to yourself. And let's join hands and take this whole platform to further heights. Thank you.
Thank you very much. So inspiring, Dr. Altaf Khattak.